just want to do a sound check. If you can tell me your
Sure.
name and what you do.
Yep, my name is Gregory Mesna, and I'm a plastic surgeon in Minneapolis, Minnesota.
Okay. I'm good.
All right. Okay, Dr. Mesna, what were your goals in establishing this practice?
When I started this practice, I wanted to develop an environment where patients felt like they were, I got to start over.
Okay.
Let's see.
Just tell me what you know.
Okay. When I started this practice, I wanted to develop a friendly environment where patients felt like they were provided the best services possible from providers who felt like they really cared about them as an individual.
What kind of atmosphere are you trying to establish here? Or have you established here?
You know, we have a warm and inviting atmosphere with an upbeat and positive attitude.
Okay. Where do you think that comes from?
I think it comes from the staff. We have some very talented staff who really enjoy what they do, and I think the patients can pick up on that and feel it when they're here.
Okay. What led you into plastic surgery?
You know, I think plastic surgery combines aesthetics and medicine and allows me to offer procedures to patients that can really make them feel better about themselves. For a lot of patients, we can offer life-changing procedures that they otherwise can't achieve on their own. What we can do with a couple of hours of plastic surgery, most patients can't do with a lifetime in the gym.
What kind of life changes have you seen in your patients, some of your patients?
You know, for many of our patients, a lot of the procedures, a lot of the larger procedures are truly life-changing. We see immediate changes in their self-image and confidence, and we also see long-term changes in their lifestyles and activities.
Awesome. How have you seen those changes in confidence manifest?
Most of the times we'll see patients carry themselves differently and act differently and dress differently from the first day that they come in for their follow-ups.
Super. How do you work with your patients?
You know, most patients will come in for an initial consultation and evaluation, during which time we try to really listen to what they have to say and what their concerns are and problems are, and try to help them establish what their real goals are. Then we will oftentimes take a look at the patient to make sure that what they're asking for is consistent with what they have to work with. After we've established that they have a problem that we can identify and fix, then oftentimes we will have them back for an additional consultation so that they have plenty of opportunity to think about the procedures and ask any additional questions they might have. We also go over all of their post-operative care with them ahead of time so that they are well informed and understand what to expect for the recovery. We find that with a lot of education ahead of time, most patients are very comfortable and have less problems with fear and anxiety about the surgery.
Okay, very good. What can patients expect after their procedure?
Most patients find that they are very well informed ahead of time and can expect a smooth and uncomplicated recovery. We are available 7 days a week, 24 hours a day, so if patients have questions after hours, we're always available to take care of those questions for them.
How proactive are you in your follow-up?
Very proactive. We have
We're very proactive.
patients that
Start over, please.
we're very proactive in terms of our education ahead of time and contacting the patients after surgery and ensuring that they will come in for their follow-ups afterwards.
Okay, one more time on that. We're very proactive in our follow-up.
We are very proactive in our follow-up, and we like to educate the patients as much as possible ahead of time and ensure that they will come in for their follow-ups as soon as we can after the surgery.
All right. What are your goals for your patients in terms of outcomes?
Our goals are to help them to achieve a feeling about themselves, that they are more confident and feel better about themselves.
You're doing fine. Don't worry.
Now, our goals for our patients are that we can help them feel,
Yes,
our goals for our
sorry.
patients are so that we can help them feel better about themselves and feel like we have given them the best care possible in a friendly and secure environment.
Okay. Did I step on him?
Yeah, I think you were on top of them.
Okay, one more time I stepped on you.
Okay. Our goals for our patients are that we can help them feel better about themselves and that they feel like they have gotten the best care possible from staff who really care about them as an individual.
Okay. What's the most satisfying aspect of your work?
I think the most satisfying aspect of my job is that I can do things for patients that help them feel better about themselves that they otherwise couldn't do for themselves.
So in a nutshell, why would someone choose Mesna?
You know, I think people come here because they understand that we truly care about them as an individual, and we will do everything that we can to help them feel better about themselves and achieve their goals.
Okay. Here's one we haven't talked about. I'm going to throw it out. Technology. How important is it to stay on top of technology in this business?
You know, a lot of the procedures that we do are well grounded in many years of experience. There are small pieces of new technology that are always being developed and introduced, and we take a look at those with a little bit of a conservative eye and try to make sure that anything that we offer for our patients is effective and safe before we will employ it in our practice.
Okay, good answer. Is this exclusively a female practice, or
No.
do you get male practice?
We take care of plenty of male patients as well. The numbers are always increasing, and there are certain procedures that are more common for men than others. Those being typically facial procedures, eyelid lifts, liposuction, and treatments like that.
Okay, was that in the clear, or do we need to do that again?
It was clear.
Okay, all right. Moving on. Topic, facelift. What is a facelift?
Facelift or a neck lift is a procedure that we perform to lift and tighten the skin along the jawline and under the neck area.
And what's the benefit of this procedure?
This procedure can oftentimes take care of loose excess skin that normally makes patients look and feel older about themselves.
Typically, who's a candidate for this procedure?
Patients who have loose and sagging skin in the cheeks and jaws and neck area are typically our best candidates for these procedures.
Okay, what are the factors you consider in this procedure?
The age of the patient, the amount of loose skin that they have, the elasticity, whether or not they're good candidates for surgery and in otherwise good health.
Okay, we'll take that one more time. Remember to answer it as a complete statement.
Okay.
The factors we consider are, and then go ahead with your answer.
The factors that we consider in selecting patients for facelifts or neck lifts include their overall health, the condition of the skin, and what we can hope to achieve by performing these procedures.
What are the steps in the procedure?
The patients will go through a normal preoperative examination and evaluation. The procedure itself usually incorporates incisions around the ears so that we can lift and tighten the skin along the jaw and neck areas, and then hide the incisions around the ears when we're done.
Okay. Can any other procedures be performed in conjunction with a facelift or a neck lift?
Yes, oftentimes other facial procedures are performed at the same time, including eyelid lifts, brow lifts, occasionally rhinoplasty or ear surgery, and even other procedures on other parts of the body we can perform at the same time.
Okay, you want that one again?
I think so. Just the very beginning was.
Yeah, you kind of jumped over yourself at the
Okay.
beginning. So one more time, can any other procedures be performed at the same time?
Yes, we can perform.
Don't say yes, because they won't hear the question.
Oh, gotcha, okay. Other procedures that are oftentimes formed along with a facelift include eyelid lifts, forehead lifts, rhinoplasty, or even procedures elsewhere on the body.
Very good. And what can what can patients expect after surgery?
Most of the time, patients can expect to have an uncomplicated recovery, and they will see some nice immediate effects, which continually get better for several months after the surgery.
So there's no side effects at all?
There are risks associated with all the procedures that we do. Some of the side effects are swelling and bruising, and occasionally those can take 2 or 3 weeks for them to resolve to the point where patients feel comfortable going back out again in public.
Okay. Is there any way they can mitigate those effects?
Oftentimes, after surgery, patients will keep their head elevated and use ice packs to minimize some of the swelling and bruising so that they can look better sooner after the surgery.
Okay. So for anyone interested in this, what's their next step?
We have additional information available for these and other procedures throughout our website, and if patients have additional questions or if they would like to schedule an appointment, we encourage them to contact our office.
Okay. Do you have a complimentary consultation?
We offer complimentary consultations for cosmetic procedures.
However you want to say that.
Yeah. Let me think.
I didn't know if you just wanted to
Yep, I
inject a
know.
word. Okay.
We offer complimentary consultations for cosmetic procedures, and if patients have additional questions, we encourage them to contact our office for an appointment.